Hello and welcome. Our daily positivity rate under 3% for the last 40 days. India has logged 19,740 new COVID-19 cases, 23,000 recoveries in the last 24 hours. With this, India's active caseload now stands at 2,36,000, which is the lowest that we've seen in 206 days. So is it time to rejoice? Time to whip off our masks and celebrate? Well, amidst a threat of a third wave of the coronavirus, the government has asked Indians to avoid crowded places during the coming festival and wedding season, as India's fight against the pandemic is still on. Please watch your October, November and December. That is what the Joint Secretary with the Health Ministry, Love Agarwal, has said, warning all of India about the threat of a COVID-19 resurgence during this coming festival month. A few months actually. We have Dussehra, Diwali, Durga Puja, Milan and Eid, and of course Christmas and the wedding season. Mr. Agarwal was speaking at the weekly media briefing in the national capital. We also had the Niti Aayog member for health, VK Paul, present, who said we cannot take the current stable situation for granted. We have to be mindful of the fact that the pandemic is going on and can take an untoward turn if we are not careful, Dr. VK Paul has said. So, what do we need to do to protect ourselves and our loved ones going forward? Joining us is Dr. Randeep Guleria. Thank you, Doctor, again for your time. So, please watch your October, November and December, said Mr. Agarwal, warning Indians about the threat of COVID-19 resurging during the coming festivals. First and foremost, there's a threat of a resurgence even after this, 203 days of the lowest number of cases, etc., etc.
So I think it's better to be overcautious rather than to regret later on. And I think that is what is being sort of put forward. Because we had a situation where we were seeing very few cases in January and February. And then we saw a huge surge, which was the second wave, because of the fact that we left our guard down. And we had a lot of activities where there were huge crowds. And this actually led to two things. One is resurgence of the cases, along with new variants emerging. Initially, we had the Alpha variant and then the Delta variant, which led to a huge spike in the number of cases, and we saw a lot of misery and death at that point in time. So I think it's very important that we continue to be cautious. We are in a much better situation than what we were in a few months ago, but we should not lose the momentum and the advantage that we have right now by letting our guard down.
So there are two ways to look at numbers always. So we have a situation where the situation is plateauing, the number of cases, but India is still reporting as high as 20,000 odd new infections every day. Is that high, doctor?
So that is still significant, but I won't say that it's high. I think we're moving gradually into what I would say is from a pandemic to an endemic stage. Because although you're seeing this number, which is almost gradually coming down, we were between 30 to 40,000 some time back, then 20 to 30,000, we're now hovering a little less than 20,000. But what is also interesting is that although the cases are still hovering around that much, the recovery rate is good, the vaccination coverage is excellent, and along with that, we're not seeing a huge surge in hospitalization or deaths. That means the vaccines and the immunity that we have acquired either naturally or through the vaccine is helping out and holding on as far as serious infection is concerned.
But the fact is that, yes, the overall positivity around India gives us comfort, but we do have a large number of districts reporting high case positivity. There are 5 states, Mizoram, Kerala, Sikkim, Manipur and Meghalaya. Is that a concern? 4 of these states in the northeast?
Yes, the northeast is a little bit of a concern because there the positivity rate is high, and also considering that this is an area where health facilities are not that good, and there is also the population is not that high, yet we are seeing an increasing number of cases. I think this is a cause of concern for 2 reasons. One is that obviously the number of cases are going up in that area. But we also know that if we have more cases in a particular area and the virus continues to multiply there, one needs to be very vigilant in terms of surveillance, in terms of genome sequencing, because you may have a variant developing in that area, because as the virus multiplies, higher the chance of mutation, and if you have mutation, you will get variants of concern developing in that area.
All right, doctor, let's move on to vaccines. You say we're in a good position when it comes to vaccines. We've administered over 93 crore COVID-19 vaccine doses so far since we began our drive on the 16th of January. So we're nearing that 1 billion vaccine doses mark. But what about the scale up in other aspects? Do we need to focus on that too? For example, the shortage of oxygen?
Yes, so I think we need to be prepared for everything. Our vaccine drive is doing well, but we need to really reach out and cover those people who are not coming to the vaccination centers because of various reasons in terms of co-morbidities or being elderly or not able to reach the vaccination site. We need to really develop a strategy so that we reach out to them. But we also need to prepare for contingencies, and that includes ICU beds, oxygen, and other things. And I think this is important because this is going to be something which will be useful in the long run also. If hospitals have their own oxygen plants and they are self-sustaining, especially in rural India, we will not see a problem even later on. Then this would be useful in the long run also. Remember, a few years ago, we had an issue of oxygen shortage in Gorakhpur, which in one's area where children died because of shortage of oxygen. So this will be useful in the long run also.
And Doctor, in Tamil Nadu, there was a seroprevalence survey conducted that shows 70% of the population in the state has been exposed or had been exposed to COVID-19. And it said that the most affected regions during the second wave included Coimbatore, Erode and Salem, I think, which have all actually reported 71%, 70% and 60%. So that, I mean, naturally that makes sense?
Yes, so I think with the number of cases that we've seen over the last few weeks in Tamil Nadu, and the vaccination, we have now a large number of the population which has antibodies. So that is a good sign because that would mean that the population is protected against severe infection. There is one rider that we need to remember. The protection of the antibodies is with the current circulating strain. If the virus mutates and becomes a new virus or a variant becomes something which is totally has an immune escape mechanism, then the efficacy of the antibodies that the person has will fall to a significant extent. And that is why, despite having a high degree of antibody in a state, we still need to push for COVID-appropriate behavior so that we make sure that we don't lose out the momentum that we have right now.
And also this week, Doctor, 2 Indian drug makers sought to end the trials of the generic Merck pill for moderate COVID-19. Is this disappointing? Because, you know, the oral drug was hailed as a game changer. It was touted to become the first antiviral medicine to treat COVID-19.
So this is something that will happen. You will have a large number of drugs which would be tried. Some will actually make the grade, others will not really work in clinical trials, although they may show utility when you look at animal studies or in the lab. And that is still something that we need to keep in mind. But the drug that we're talking of, molnupiravir, has actually been shown to have some good antiviral activity and decreases severity of infection. It decreases viral load, and therefore there is hope that we will have a good oral antiviral drug. Remember, we don't have an oral antiviral drug which is effective. The drug that we have, which is being used as an antiviral drug, is remdesivir, which is given by the parenteral route or the intravenous route. So if we are able to get a good oral antiviral drug, and there are also studies in India going on looking at a nasal spray also, which uses nitric oxide. So we are looking at new antiviral drugs, and I'm hopeful that we will get an antiviral drug which will help us, because this is urgently needed. Our vaccines are doing well, and we have now a huge number of vaccines. I wish we had that many antiviral drugs which could help us fight COVID-19 in the hospital or treat cases. We are not able to do that. We are still just basically giving symptomatic treatment to mild cases.
Well, clearly, till now at least, no substitute for vaccinations. Doctor, this week, finally, that ugly chapter was closed, and it was declared that there's going to be no quarantine, UK quarantine for fully vaccinated Indians starting from the 11th of October. So a lot of cheer went up all over, people who are wanting to travel, students especially who needed to travel. But the irony is, this comes at a time when the UK is Europe's new virus hotspot, and one of the highest rates of COVID infections in Europe are being reported from here.
That's true. So the issue is two parts. One, of course, is that I think it was something that didn't make any logical sense because the vaccine was made in UK. It was licensed to Serum Institute by AstraZeneca for production, and therefore now not accepting it didn't really make much sense. And I'm glad that this chapter is over. But having said that, we need to really be careful in terms of travel to areas where the positivity rate is high and where restrictions have been lifted almost totally, and therefore there is a high chance of getting infection. Remember, we still need to be cautious. The pandemic is not over. We are seeing a global decline in the number of cases, but there continue to be hotspots, and we need to be careful about going to areas where there is a high chance of getting infection.
And, of course, the second wave you're saying is not over. In the midst of all of this, everybody is going around getting the flu. This is flu season. So, Doctor, now experts are saying this winter, along with the COVID vaccine, we need a flu jab also. That's vital.
Yes, so there is some data emerging which suggests that the flu virus may come back with a vengeance and we may see more and more flu cases. Already when we are even in Delhi, when we are looking at cases, many of them who come with classical symptoms of fever, cold, cough, the COVID test turns out to be negative, but the flu test turns out to be positive. So we are seeing patients who are developing flu, and therefore I think for all people who are at high risk, the elderly and those with comorbidities, they must take the PreWinter Flu Jab because that will protect them during the winter months against flu infection, which can actually at times be serious. So I think it's important that people do take their flu jab this time because we don't want to have another surge of cases which could mimic COVID.
And Doctor, before we go into a break, tomorrow is World Mental Health Day. Depression, anxiety, disorders saw a marked increase during the pandemic, says a new Lancet study. Now, this COVID-19 pandemic has taken a toll on people's mental health, but do you think the global extent of this impact remains largely unknown, especially in a country like India, where we've historically not given enough attention to this issue, where it's also there's been a stigma to it? Is this another ticking time bomb that we're sitting on? Your thoughts as we approach World Mental Health Day?
Yes, tomorrow is World Mental Health Day, and the theme actually focuses on inequity or unequal healthcare being provided for mental health. And I think it's very important because the pandemic has really opened up this whole issue and made us realize that we have not really addressed mental health as we should. And this has become a bigger problem as far as post-pandemic or during the pandemic is what we're seeing. And that's because of multiple reasons. One reason, of course, is the pandemic itself has caused a huge increase in mental health issues. It's not only people who have COVID that have been affected by mental health issues. It's also people who have not had COVID, but because of the stress of the lockdown, because of stress of losing their job or worrying about how they will go about life and being sort of confined to an area, whether it be children, adults, or the elderly, there has been a huge strain on them, and this has led to huge mental health problems, from depression to panic attacks to serious problems as far as mental health is concerned. And therefore, I think we need to start addressing this seriously. This is going to have a long-term impact. And I'm sure that the numbers are much more than what we are currently thinking. And there has to be an aggressive long-term policy or plan of how to go about addressing the problem of mental health.
All right, Doctor, we're going to go in for a short break, but after that, I want to ask you about that big scientific breakthrough, the big story in the world of health, a vaccine for malaria, and what this means for India. After a short break, we'll be back with Dr. Guleria. Welcome back. We're talking with Dr. Randeep Guleria of the All India Institute of Medical Sciences about fighting the spread of the coronavirus. And Doctor, I want to just end by asking you to touch upon the big triumph of science this week. The world has come up with a vaccine for malaria. really giving us hope for the first time, and the WHO approving this anti-malaria vaccine that really would be counted as a triumph. But what does this mean for India? When is it likely to be available in India? You know, I think in 2015, India was among the 18 global leaders who pledged to eliminate malaria by 2030. Can we finally be optimistic about this deadline?
Yes, I think this is great news. We've known about the parasite which causes malaria for more than 100 years, and this vaccine has also taken about 30 years to be developed. It needs to be given it as 4 jabs, and although the efficacy of the vaccine is low, the trials suggest that the efficacy is only about 30%, but it does suggest that it helps in decreasing severe cases and therefore would be effective. But I think if we have to really have elimination of malaria, this has to be combined with good malaria control program that is already being rolled out in various parts of the world, including India. So this will be an add-on to the ongoing program, and with that it should really help in bringing the cases down. We have seen a significant decline in the number of cases of malaria in our country, and I'm hopeful that with number of strategies, which includes vector control strategies, which include chemoprophylaxis, and the whole program that is there for malaria control, this will actually be a big boost. Hopefully, it should be available in India soon to be given in those areas which are hotspots as far as malaria is concerned.
Dr. Guleria, thank you so much, as usual, for joining us every week, taking the time out for us to answer all of our audience's questions, queries, because as you pointed out over the past few months as you've done shows with us, you know, the goalpost keeps changing, the enemy keeps changing. So we thank you for still taking out the time for us and for the show. Good night.